Although acute uncomplicated bronchitis is, by definition, self-limited, more than 70% of the estimated 100 million ambulatory care visits for this problem in the United States each year result in an antibiotic prescription, each of which is unwarranted since well in excess of 90% of cases are caused by a viral infection. The following are some key points regarding the management of acute uncomplicated bronchitis. In contrast to commonly expressed beliefs, neither sputum purulence nor a change in sputum color is an indication of bacterial infection. Acute uncomplicated bronchitis is distinct from acute exacerbation of chronic obstructive pulmonary disease, an illness that is in contrast often improved with antibiotic administration. Acute uncomplicated bronchitis must be distinguished from pneumonia. However, if the patient is less than 70 years of age and immunocompetent, chest X-ray for detection of pneumonia is not indicated as long as all of the following are absent: a heart rate greater than 100 beats per minute, a respiratory rate greater than 24 breaths per minute, an oral temperature greater than 38 degrees centigrade, and the presence of rales, egophony, or fremitus on chest examination. When the history is suggestive of acute bronchitis, there is no indication for sputum analysis, serological analysis, or, in the absence of a suspicion of acute influenza, viral diagnostics. Antibiotic therapy of acute uncomplicated bronchitis is associated with minimal or no improvement, but with a significantly increased risk of adverse events.